Hello, my name's Jane Cummings and I'm the Chief Nursing Officer for England. And I want to take this opportunity to talk to you about the vision and strategy that we've been developing over the last few months alongside nurses, midwives and caregivers across England. I feel really passionately about this vision and strategy and thought it would be a really good opportunity just to share with you some of my thinking and the thinking of others that's helped us to develop this strategy as we've been working with people on the front line for a few months now. So what do I want to achieve? What was the ambition and the aim of developing a new vision and strategy? For me, it's about getting an increase in respect for our professions. We have been the subject of some quite negative publicity over the last few months and years, and although most people I speak to are very proud to be a nurse, a midwife or provide care within the NHS or social care system, there are others that feel quite battered, quite bruised and quite vulnerable after some of the negative stories. Fundamentally, I want to be in a position where we have an increased pride in our profession so that we can go shopping, go out, talk to the taxi drivers and feel really proud to say that we're a nurse or a midwife or a caregiver. And I also want the public and our patients to respect us as individuals, to respect our competence, our skill, our care. And at the end of all of that, what is the most important thing for us? It's putting patients at the heart of what we do. And it's about providing an improvement in the care that those patients receive, the outcomes that they get, and the experience that they have when they need our services. The NHS Constitution is really important to me. The NHS belongs to us all, and this particular paragraph from the beginning of the Constitution I think really underpins the values of the NHS and what we're here to do. The fact that it's there to improve both health and well-being, both in mental and physical illnesses. It's about helping us to get better when we're ill, and also when we can't fully recover, to stay as well as we can until the end of our lives. It works at the limits of science, and it brings together the highest levels of human knowledge alongside the need for care and compassion. And the one thing that I think is really important is that last sentence, which says, it touches our lives at times of basic human need when care and compassion are what matter most. And for every one of you watching this, whether you be a nurse, a midwife, a caregiver, in whatever setting, or you're a patient or a member of the public, you will all be able to recall instances where you've either given care that you feel really proud of and you know you've done a really good job, or where you've received care that you are absolutely confident was right and it made you feel safe and well looked after. But many of us can also think of examples where we haven't done something as well as we would want to, when we haven't been able to give that care and compassion at the times when patients and our public really need it. And this vision and strategy is all about how can we improve that? How can we work together to take action in a way that actually makes that meaningful every time a patient or a member of the public receives the care that they deserve? The nursing narrative is also really important to me. We do quite often talk about nursing as being looking after older people, for example, in acute hospitals. And we don't recognise the full breadth and depth of the nursing and midwifery and caregiving profession. We don't necessarily recognise or talk about the different settings in which care is provided. And we also are working in an environment where we've got staff that in many cases, as I've said, feel quite burnt out or under significant pressure, and when we've had negative stories published, like the ones that were done through the Patients Association. Very, very strong stories which describe in detail that is uncomfortable to read about the care patients have received. All of that setting, I don't think necessarily describes nursing and midwifery and care in a way that we think we should. So one of the things that we've been doing is looking at how we can describe nursing and midwifery and care of the future. So not just looking back into the past, but looking forward and thinking about what we need to do as we move forward. Something that recognises the full breadth and depth of the profession. Something that recognises that care is provided in hospitals, whether they be acute, specialist, mental health, for example, that we provide care in the community, within primary care, within nursing and residential homes, and within patients and the public own home. Let's recognise the full breadth of that profession and the fact that nursing is an incredible career, that you can work in many areas of practice, that you can work in education or research, and you have the ability to link care with knowledge and skill. So you've got the technical knowledge to be able to do the job properly, to be able to understand what you're looking at and what you're seeing, to be able to make judgments on how ill or well an individual is. But you also do that with the care and compassion that really matters to our patients. I've been working on this vision since I was appointed as the Chief Nursing Officer, and it started with 4 C's, and they've gradually increased to 6 based on feedback we've had and also discussions with other people. I think these 6 C's really underpin the values and behaviours that actually epitomises our professions. And I'll just take you through each of those in a little bit more detail. Care is the first one. Care sits at the heart of what we do. Delivering high quality care is what everybody expects. People have a right to it, they expect it to be consistent. And care is effectively what we do day in and day out. Compassion relates to the way in which that care is given and how it's perceived by our patients and public and relatives, for example. And it's based on relationships that are full of empathy, kindness, respect and dignity. Competence relates to having the knowledge, the skills and the capability to do the job to the highest standard based on evidence and research. It reflects the need for people to be highly educated, but to do that with the right values and behaviours. Communication links to the ability to communicate predominantly with our patients and the public, to make sure that we are active listeners, so that people can understand what we're saying and we can understand what they need from us. It also talks about communicating with our peers, with our teams, we all work in teams, with our leaders and with each other. And from my personal view, it's about how I communicate with the hundreds of thousands of nurses, midwives and caregivers that are actually out in the service at the moment. Courage relates to the need for us to do the right thing. Some of that's about speaking up when things aren't going as well as we would want them to. It may be about challenging poor or bad practice. But it's also about being bold to make the right decisions. And that could be moving services out of hospital, for example. It could be trying a new service, or it's about speaking up when you've got a really great idea. Everybody has good ideas, and it's about the ability to take those ideas and implement them across England. And lastly, commitment. There is a huge amount of commitment to improve care and to do a good job, and that's something that's been really noticeable to me since I've been appointed and in my time going up and down the country and talking to frontline staff. But we also need to commit to take an action. And I would like people to, if they sign up to this vision and strategy, to really commit to taking action, to working with each other, to really help us implement it. So it's all very well having these 6 C's and these 6 values, but what are we going to do about it? Some of the feedback we've seen so far has been, yeah, it's okay, so it's a lot of words, that's good, but what are we actually going to do? So we've come up with 6 areas of action that we believe, and we've tested this with quite a lot of people, think are the right things and the right areas for us to focus on. One of the questions in the engagement document actually asks for your views about that. Are we focusing on the right things? Is there anything that's missing? What do you think we should do? And I'll just take you through very quickly what we're thinking about in each of those 6 areas at the moment. So the first one is about maximising health and well-being, helping people to stay independent and making sure that we've got the right outcomes for many of the population as we can. That we talk about making every contact count. In other words, every one of us has an opportunity to really help people have the best health and well-being outcomes and to stay as independent as long as possible. The second area is working with people to provide a positive experience of care. So for me, that is, how do we design services that actually meet the needs of our patients and the public, rather than necessarily meeting the needs of staff, for example? How do we design services with our patients? How do we understand and find out what it is they want and need? And how do we design a service that is truly integrated, so that from a patient's point of view, they don't need to know necessarily which organisation is providing care. What they need to know is that they're getting the care in a seamless way. How do we look at the experience of patients? How do we interpret that? How do we find out about that? And then what do we do to act on it? And I'm not talking about an annual survey. I'm talking about something that is much more meaningful, much more in real time, so that we can act quickly, take decisions, and be very transparent about what we've done to improve our patients' experience. It's also something in this around promoting the personal responsibility for health and well-being. So talking to patients and the public as active participants in their care, not just passive recipients of care. So what can we do with members of the public and with our patients and the people we care for them to take some personal responsibility for their own health and well-being as well. The third area is around delivering high quality care and measuring the impact. So truly looking at evidence-based care. What is the best care that delivers the right outcomes? How well are we doing with that? Are we being open and transparent in the care that we're providing? We've just done a piece of work evaluating how to measure nursing quality. For me, you often get stories about poor quality that people automatically equate to poor nursing or midwifery care. Yes, that's sometimes the case, but it's not always the case. So how do we truly identify how to measure good nursing quality? So we've done a piece of work on that, and we're likely to be expanding that further. So we want to come up with some very clear measurements that will actually be able to demonstrate the good quality care. And we can be transparent about it, show when we're doing a good job, and perhaps when we're not doing as well as we want to, we're able to say what we've done about it. The fourth area is about building and strengthening leadership. The leadership role of nurses, midwives, and all of those in a care team is really important. The role of ward sisters, team leaders in the community is probably one of the most important roles we can have. How can we develop those individuals to have time to lead in the way that means they can support their staff, help with their patients, spend time with patients and relatives is really important. How can we empower nurses, midwives, and registered care home managers to really make local changes to improve care? We want to look at how we have the right staff with the right skills in the right place. So that's around using evidence-based staffing levels. It's not about mandating minimum staffing levels or a minimum skill mix. It's about making sure that those who with the responsibility for staffing use evidence and look at the case mix and the dependency of their patients they're looking after to determine what the staffing levels should be. Being able to account for those staffing levels is really important, and to look at the outcomes. We also need to make sure that we have staff with the right values and behaviours and right skill set. We've done quite a lot of work with universities up and down England to look at how they recruit, and it's really important that we do that for all staff, that we recruit people with the right values and the right culture, and that we use things like assessments and lifelong learning to continually improve on that. So really important functions for us. And then lastly, how do we support staff to have a positive experience? It is well known that a positive staff experience is very strongly related to a positive patient experience. Being a nurse, a midwife, or a caregiver is very hard work. It's emotionally draining, and it means that people do get tired, they get burnt out, and we need to recognise that, and we need to support staff so that they're able to give the very best care that our patients and the public deserve. So having some care and compassion for our staff is also really important. Making sure that we create worthwhile and rewarding jobs, that we provide appropriate clinical supervision and preceptorship to newly qualified staff, and that we support each other. Using technology to free up time so that nurses can spend time doing what they do best, which is spending time with patients and the public, is really important. So again, a very important part of our 6 areas of action. So some thoughts from nurses and midwives. We've had quite a lot of information. I'm recording this a week after we went live with our vision. We've had about 40 completed sets of information back onto our website. We've had another 60 that are partly completed. We've had 25 blogs, and we've got lots and lots of tweets. So we're beginning to get some really good information back and some great engagement, and I want to see more of that. The vast majority of people have been supportive. We have got some people that are not so supportive, and we want to understand that, so please tell us what you think and why you think it. But overall, we've had some great responses. There are many ways that you can let us know what you think. If you look at www.commissioningboard.nhs.uk/nursing vision, you will find the information and the ability to respond. We've also had the following blog, which I had from somebody that fed into me at the commissioning board, who said that the 6 C's were really good, but actually in reality what was important in that individual's working life was a feeling of, what effectively are B's, so being bullied or burnt out or bewildered or blocked or bemused, So what can we do to avoid that? What actions do we need to put in place that actually stop people feeling like this on a regular basis? How do we implement all of this? I won't spend long talking about this because there's lots of information around on the NHS change model. But for me, one of the important things is to do everything that's on this slide. So we have a shared purpose. We understand where we're going, and we know what our purpose is, and you can tell, and that's clearly documented in the vision and strategy. But that we look at all these different aspects. So we look at spreading innovation. We look at using a methodology of improvement. Doesn't matter what it is, as long as it's a recognised one. That we ensure that we deliver this rigorously. So we, in the commissioning board, will look at the actions that we agree that we need to do and make sure we deliver them. That we're absolutely transparent about what we're doing. We're open, we keep people informed about where we are, and if we're not doing well, we understand why and we do something about it. We engage to mobilise, absolutely critical. There are hundreds of thousands of registered nurses in England, and if we can get everybody engaged to mobilise for this work, it will have a massive impact. And we lead across the board in order to do that, and use the system drivers. So what can we do with things like the contract, or with Sequin, or with the way in which we commission, that absolutely helps us to deliver this key priority. So where are we? As I said, a week ago we published the vision. We've got 8 weeks of further engagement. I've spent a lot of time up and down the country talking to nurses and midwives, and we've got a lot more planned. We really want to hear from you, really want to know what you think and what your views are, whether you're a current nurse, midwife, caregiver, whether you're a manager, a chief executive, a doctor, an allied health professional, whether you're a member of the public or a patient. We really want to hear from you about whether our vision, strategy and areas of action are going in the right direction, or is there anything else that we need to do. We will then collate all of that information, and we aim to launch the strategy later in the year. And finally, I like this quote. Alice Walker, who's an American novelist, said, "The most common way people give up their power is by thinking they don't have any." Every single one of us, irrespective of what we do within the NHS or social care, impacts on the care that patients receive. Every decision we take, whoever we are, has an impact on the patients that we look after. And we need to remember that, whatever we do. Collectively, if we work together and use the power we've got, we can really make a difference.